everyone, I'm Maimah and I'm your host for Breathe TV, your sacred space to learn to navigate your breast cancer journey. Today I have some women with me that are amazing advocates and healthcare practitioners. We have Shonte Drakeford, a dear friend and advocate. Hey Shonte. We have Aliya Whipple as well, who's with us, and nurse practitioner Sonya Gallaway. Aliya, I've just learned your story and it's so powerful. I learned that you were diagnosed with breast cancer in the midst of the COVID-19 pandemic. People were stunned about COVID, as you know. It was shocking, it was scary. What was it like to be diagnosed during COVID?
Well, actually, my diagnosis was right before the pandemic. It was the end of January when I was diagnosed. Kind of gloomy weekend because we had lost Kobe Bryant. It was tough in the beginning because everything was happening so fast. I was alone. I had to do everything alone. It was just really hard. I was by myself the entire time, but my doctors were great as far as being very supportive and explaining as much as they could because they were also learning about COVID. So it was like a double whammy. I have cancer patients and I have COVID, and we got to keep COVID from the cancer patients. It was a whirlwind. I was diagnosed with the BRCA2 gene mutation early in, I'd say January of 2019. And I just decided to take a positive approach to it. And what I would do is, I'm a mother of many children. I have 7 total. And I decided to take it as a time for myself, so when I had to go through treatment, it was my time. It was me time. I just made the best of the situation by being optimistic and thinking positive.
Much like you did, Aliya, and Shonte is very positive, and I'll let her tell you how she navigated COVID-19 being an MBC patient.
Because my immune system is compromised, I was concerned of contracting COVID and the severity that it will impact me, because I got sick probably 2 years ago due to low immunity. It was just an upper respiratory infection. And I was down for like 3 to 4 weeks. My doctor almost admitted me to the hospital. I was practicing and still am as a nurse practitioner, primary care provider. I was really happy to practice in clinic, but I had my first patient. I was trying not to have that nurse's guilt. I was like, I could do it. I've been good at preventing illness. And my first patient was like, I've been exposed, and I was terrified. Fear just came over me. And I was like, I can't do this in clinic. And diagnosing became a little bit difficult because most of my patients, and they don't have the technology, nor the resources, nor the bandwidth, nor the unlimited cell coverage to utilize video conferencing, which is pretty vital because then I could see them at least and assess them better. But now it was like, I got to do everything over telephone. And then my hours got reduced because of the funding. I can't, see a lot of patients in person. So I'm only now able to see patients who need refills and things. And so it affected me. And then my, cancer doesn't stop. So I still have to go to get treatment. And I was terrified, still am terrified. Just like Aliya said, you can't do this. You have to do it alone. So I have to get scans every 3 months. I have to do that alone. Although I still can't work every day, I still can be at home with my husband. I don't have any children. We tried. I had fertility issues before diagnosis, but we just got more with my farm. I have a farm now, and I just kind of increased my produce, and I got more chickens.
Where's my produce? I haven't gotten any eggs or milk or cheese or nothing.
It's coming. I'm gonna give you a whole package. I'm gonna give you my duck.
I need to put my order in.
I got you.
Yes, boo. I mean, I feel like I'll say this. I feel like the whole world got to experience what it's like when you're a cancer patient living with critical care and or a caregiver of somebody who's terminal or who's in, acute care, because when you're going through breast cancer and you're in that depressed, overwhelmed state, and or you're in treatment where your body's debilitated, you're in this whole bubble that the world can't really see. All they see is what they see on social media. And for those patients, many of who are my friends, they're There's one face on Facebook and there's one face that I see when they FaceTime me. The loneliness when you're at home and can't go out and travel because you have to be safe about your body being compromised. The whole world was now in the same space that we've all been living in for many, many years, So in a sense, I feel like the world got to see what it's like when you're living at home and living with trauma, living with fear of recurrence, living with day-to-day taking care of a person and being afraid for their outcome, I missed my screening because it was COVID time, right? It was coming to COVID. So I made the appointment, went to the doctor to get the screening, and I was terrified to go in the hospital. And I am a strong advocate. I know better, but I was like, do I go in there and be exposed to COVID or do I just wait? So I totally get the fear that people have about recurrence. If you're not getting screened, if you're not getting your checks done, you can have the cancer progress or, show up and grow. So I wanted to ask Sonya, you've heard Aliya's story and Shonte's story and a bit about mine. Can you talk about how you're helping patients stay in that continuum of care as we're navigating this pandemic?
I am a nurse practitioner. I've had the privilege of working with oncology patients for many, I'm old, many years.
You don't look old.
I was going to say decades, but that'll really tell how old I am, but a long time. I currently work as a medical science liaison for Puma Biotechnology. So I haven't seen patients or had on patient contact since actually it was right before we went into shutdown. But, I think as we try to navigate it and try to manage this pandemic together, healthcare providers were as in the dark as everyone else were. We all had the right to be afraid. We didn't know what we were dealing with. We really weren't even sure about the mode of transmission. And it was the novel coronavirus. And we were kind of learning as we go along the way. So when you say your fear of going into the hospital, of getting your screening, it was a founded fear because we didn't really know what could happen if you did that. But I think as we've learned more, we have to have faith in the fact that masks really and truly do help. And there is more of a risk of you not getting the screening that you need and having a progressive cancer or having something go undiagnosed. That risk is greater than it is for you to get coronavirus. But if you're taking the proper precautions of wearing a mask and washing your hands and not being around a whole lot of people, we really do need to get these screenings. Black women have more aggressive breast cancer tumors than white people do, or other people, other populations were more prone to have triple negative breast cancer, which is an aggressive cancer. We die at higher rates of breast cancer than other populations do. So we really need to be on each other, both in the healthcare and each other. Are you your sister's keeper? Yes, you are. I got on my sister's nerves so bad, I took her to every single appointment. She's in her later 50s and she hadn't had a mammogram, hadn't had a pap smear, hadn't had a colonoscopy. And sometimes you have to hold people's hands and make it get done. And that's what I did. I called and made the appointments. I took her to all of those appointments, even her 6 o'clock colonoscopy. Some of these things are really preventable. You can prevent some of these things from happening just with getting a pap smear, just with getting a mammogram and a colonoscopy regularly. No one deserves to have a diagnosis of something that could be prevented or caught earlier just because they didn't take the initiative. Sometimes you got to take the initiative for them. Usually if you go and you get your screenings in time and do it consistently as recommended, if something's caught, it's usually caught in an earlier stage.
Very powerfully said. So in your role as a nurse educator, you help patients to understand the importance of coordination of care and navigating their breast cancer journey in a way that's empowered. Tell me what a nurse educator does for those who are watching, because we know there's nurse educators and then there's patient navigators. How are those different, and how does your role impact the patient in their journey?
As an educator with a biopharmaceutical company, you actually are educating the nurses and the nurse practitioners and the physician assistants on the therapies, how to manage side effects, and how to let patients know when to call you and what to look out for, and who the appropriate patients are for certain therapies and who's not appropriate for certain therapies, and what some of the alternatives can be. And you're right, coordination of care in oncology is it's important. If it's not coordinating in a way to which everybody's talking to each other and the right hand is knowing what the left hand is doing, sometimes very tragic things can happen. Things can fall through the cracks, and sometimes some bad outcomes can happen with patients. So especially when it comes to something like a breast cancer diagnosis, with a breast cancer diagnosis, you may have a surgical oncologist. You also may have a radiation oncologist, and you may also have a medical oncologist. And all three of these people need to kind of cooperate and work together so that they can coordinate all your patient activities, your lab draws, your laboratory tests, your procedures, all done in a way so it's consistent and streamlined. So if everybody needs labs, you go to that lab one time and possibly have one stick instead of making 3 or 4 lab appointments for each doctor. I've seen that happen to patients, and I empower patients. If you are having to go back and forth to a cancer center 3 or 4 different times for 3 or 4 different things, ask somebody to coordinate that for you so it's more streamlined and more concise.
So Shonte is now, you're a nurse. You know, when you're a provider and you know all that's going on, and then now you're a patient, how did being a nurse and having your medical background impact your diagnosis and treatment delivery?
I was having symptoms since I was 25 years old, and I was like a baby nurse then, probably like 2 years out of school. My husband's in the Army, and I started having like nipple discharge like the day he came back from Iraq. And so when I had that nipple discharge, I was like, "Dad, boy, you love me so much. I'm like leaking. What's going on?"
That's some post-deployment love right there.
But I immediately went to get that checked out because I'm not afraid. And I understand, like Sonya said, that if you catch anything early, you know, it's better, right? Remember, I'm 25 years old. So I go in and I was like, "Hey, this is happening. What's going on?" They give me an ultrasound. They say, "Oh, it's normal. As long as it's yellows, no issues. You're young. No need to worry." But me, I'm like, I don't know. Can I get a mammogram or something? And at that time, I didn't have any palpable cyst or any lumps yet. I got diagnosed at 31. So it's been 6 years. I've been literally trying to get like a mammogram. They would deny me, say I'm too young, I don't need the radiation exposure. All I was able to get was an ultrasound. We know ultrasounds are not the optimal thing to diagnose. I had a lump that grew and became uncomfortable, and then my nipple discharge turned bloody. I asked them, "Can you drain this? Because it's very uncomfortable. And then I know that you can get a biopsy from cysts." I told them this. They knew I was a medical professional, still was denied. They was like, "Okay, sure." My lack of awareness, because I am a patient, right? When you're a patient, you're not a nurse professional. That's why I always have someone else with me, especially my husband. When you're given a procedure of anything, and especially if it's invasive, meaning they got to cut you, poke you, prick you, something, they need to dictate exactly on this consent form that you sign, which they make you sign like immediately before surgery when you're all anxious sometimes. You should probably get the paperwork prior so you could really thoroughly look at the information, and you can request this consent ahead of time, but it needs to really label and dictate what they're doing, what kind of procedure they're doing, even from the left to right side, etc. And this consent did not say like cyst drainage, right? And because it didn't say that, it just said ductal removal. I couldn't hold him liable, even though I verbally told him that I wanted it drained and biopsied. I think that had that been done, I probably would have gotten it caught earlier. The cyst ended up becoming like this hard rock, very hard to touch. They were saying maybe it's scar tissue, right? A few months later after that, they told me to get an MRI because that time it turned hard. It was soft at all this time. The cyst was always soft and movable, but it was just big, but it became hard. The MRIs would diagnose me, and at that time is when they told me, "Oh, you could get your mammogram and you're gonna get your biopsy and all these things." So now, you know, I'm like 31, 6 years of symptoms. You're telling me now I can get it? If you have at least lymph node involvement, I always suggest that you get a whole body scan. I know it's not standard and it's not a part of the protocols and things, but there are things, even if you're not symptomatic, you get diagnosed early and then maybe 6 months later, all of a sudden you have stage 4. My inkling is always that it's been there and not, it just didn't pop up out of nowhere.
What do you attribute to the fact that you were dismissed, even as a nurse, for 6 years in the healthcare system?
I think it had highly to do with my age. They're like, "Oh, you're young. Nothing's wrong with you. You don't know what you're talking about," even though I'm a medical professional. There was a lack of, "There's nothing wrong with you." You know that mindset. it just kind of like brush you off type mindset. And because it's all these protocols, you're not getting screened, and your risk of cancer is low because of your age. And then I also think it was because of my race, but I cannot uniquely identify which. Right? I recently learned someone around my age who got diagnosed with early stage. She had the same symptoms as me, but she was a white woman. And she was offered high risk screening every 6 months to get an MRI. I never was offered that. Why?
That question still remains, and we're trying to change that through the work we're doing within Tigerlily and many other organizations as well. Because Black women tend to have more aggressive breast cancers, we have higher recurrence rates, and higher mortality rates, and there's so many barriers to care, and we don't know why they still exist. They should not, in fact, exist. Aliya, you mentioned in the pre-interview that you didn't know what to ask your doctor, and then when you asked your doctor, he or she wasn't really informative in giving you the right information. Hearing what Shonte is sharing with you, how would you have differently advocated, or how did you begin to change from going from, I'm not sure, he's not telling me, or she's not telling me, to becoming more empowered as a patient?
Once I learned of my BRCA2 gene mutation, I will honestly say that I wasn't in denial, but I just kind of didn't want to accept it. And so towards the end of 2019 is when I really started to address taking preventative measures. And so I started the research around that time. Also, like Shonte, I had some nipple discharge. Once I got to the doctor and I was officially diagnosed with breast cancer, all that research went out the window, because at this point it's like, what? The shock of actually being diagnosed. I made it my business to not just depend on the doctors. I went to my critical thinking skills and I took that information the doctor gave me. She actually gave me a diagram of my breasts, and she drew out exactly where they found the tumor. Very small. I went old school. Well, kind of new school. I Googled. I think that being curious is my health, and I know to take charge of my health. I believe, like Sonya was saying, if you keep up on top of your screenings or your appointments with your doctors, and you will more than likely be detected early, and that's what happened with me.
Well, let me ask you a question, Aliya. So we talked about earlier how we don't often talk about things when we're supposed to talk about them. So we don't talk about it before it happens. We talk about it when it happens, but we kind of whisper about it. And now you're on TV talking about it. So how did that change from the Aliya you were before to really understanding all these things?
Oh my gosh. Listen.
Preach.
I carry a genetic mutation, a gene that makes me susceptible to breast cancer. I went for some abdominal pain. Went to my gynecologist. She gave me a quick questionnaire about, all your girly stuff. And on there I had breast cancer. And I was like, here we go. I put, yes, I have family history. She said, you qualify for genetic testing. I had no idea what that was. That put a fire in me. Because I was like, and I hope I don't cry because I get so emotional when I think about this. I'm 43 years old. I've been around for 40 some years, and I've been going to the doctor since I was a little girl. I've never heard of genetic testing. Never heard of it. I've had a lumpectomy in 2015 for the nipple discharge. I put that down in the paperwork. I was told I had atypical cells that I learned later would start off breast cancer, or it looks like breast cancer. No, the only time I've ever heard of, we're going to refer to it as BRCA because that's most people call it BRCA, right? Was with Angela Jolie. So I'm like, where are the people that look like me? Where are the women that look like me that carry this same gene? Because nobody's talking about it. They talk about generational wealth, right? Let's talk about generational health. If I start talking about it, I'm not only going to help the girls in my family, I'm going to help the girls in your family. I'm going to help the girls and my colleagues who came to bat for me. They didn't know. The nurses at the hospital didn't know. When I was having my bilateral mastectomy, they're like, what is this gene? I I just shared a little bit with the nurse that was caring for me after the mastectomy. She was a young lady. She's probably about 23, 24. And she came back to me and she said, thank you for sharing it with me because I'd never heard of it. I have a neighbor down the street who flagged my husband down the other day. She's a nurse. She's a cath nurse. She was just diagnosed with breast cancer. She was complaining that she was sick all the time from chemo. I said, you don't have to be sick. They have meds for you to help you, with those side effects. She didn't know. She's a cath nurse.
Yeah,
So I realized talking about it is helping people. I'm not ashamed to talk about it. That's one thing. I'm not ashamed to talk about it. We all gonna get something. But I said I promised God, I said, God, listen, I'm not asking you to get me out of this because this is a journey for a reason, right? But I want to be impactful, whatever that is, whatever that brings. Talking about it on social media, that's fine. Being on a show, that's fine. But I just want to make sure that people know that they need to be aware. They need to go and have the screenings, the mammograms, and that genetic testing is there.
As a nurse educator, their stories are so different, yet in so many ways the same. Sonya, I keep hearing the same stories all the time, that the doctors will often tell patients certain things. The patient has to have the responsibility of living with the disease. One, they're shocked, they're stunned, they're overwhelmed, they're traumatized. But having to be like Sonya and myself and Shonte, Googling and then asking questions. And some patients have the benefit of having a more comprehensive care center and better doctors because there's more money in those hospitals. They're in these, better areas. Other patients who have literacy issues and other barriers that are financial, geographical, and generational issues around not being hush-hush about their treatments and so forth. How do you think we can start to fix the problem of all these problems? Because it's something that I've heard for the past 14 years, almost every day.
Yeah, that's a great question. I think Aliya made one of the great points is we have to really and truly start talking about it. And as you said, talking about it before it happens, not after it happens, and say, hey, well, this happened to me before too. And we got to get out there to people where they are. Even if it's to go into churches, or churches is even more convenient now, everything's online. Hey, even go into a beauty parlor and hand out flyers for people who are running for office. Now let's talk about this as well, because this is actually going to help save lives. And trying to get information out there to people where they are. Like you said, everyone doesn't have access to the internet. My father with lung cancer had access to the internet, but he wasn't comfortable in doing it. So he just basically didn't have access to it as well. So getting information out there to people and let them know what questions that they should have answered. They should demand some of these answers, and really and truly, like Shonte was saying, knowing your body. Even if a test shows that something's not right, you have to fight to get treated with pneumonia. Some of these things just anger me in a way that
I was so angry. I couldn't breathe. I got out of the bed. I couldn't walk down the stairs barely. Went to the hospital. I was in the ER the night before. I couldn't breathe, and they got some tests done. They said go home. So I went back and I said, may I have the film and the report? They never gave me either of those things. So I took the film and report and I read the words. And I'm like, you sent me home with this problem?
I think until we find a way to have us to not be invisible and recognized, we're going to have to just be loud. And Shonte, I bet you were like, okay, I'm in the medical profession. I want to be respectful, and I don't want to be seen as really a problem. But so how do you balance that? But if you're not being heard and they're not listening to you, and you really know your body, sometimes you got to holler.
And Shonte has been hollering for quite some time. Being metastatic, your treatments change all the time. For some patients who are early stagers, you have maybe the AC and Taxol or whatever, and then there's a finite period of time. You get your scans, they ring the bell, you go home. But when you're a metastatic breast cancer patient, your treatments will change because sometimes they adapt to your body or they stop working. What is that like, having to holler on a regular basis, to be aware for yourself, knowing that your treatments are never going to end? You have to be on it and be looking and searching. It's a whole level of advocacy that's different than when you're an early stager. Tell me more about that and what that's like for you.
Being metastatic, it's different, there's this stigma that you have to look a certain way, right? And I've always preached from the beginning that the cancer has no look. And being young, I feel like we're the forgotten group, right? And so I started advocacy because as African Americans, we don't talk. Talking will not hurt you. That's the thing. It does not harm you to talk. Tell your story, share your story, tell your experience, because it's nothing else is going to come from it but learning. And I understand the history component about it. I love history, and I know that the shush generation, the silence generation that our parents and my grandparents are, and I'll break that mold. And talking about it is what's going to help change things. But there is a look that cancer has. Some of my metastatic friends, some of us are skinny, some of us are heavier, some of us don't look like we have ailments per se, like me, I guess. And the quality of life is what matters to us the most, because we have to be on treatment lifelong. My doctor expressed to me he did never discuss prognosis. I know standard statistics says 3 years, whatever. I'm 5 years out now, and when I was researching, that one line that said you could be metastatic and live up to 15 years plus, I was like, that's gonna be me. I feel it in my spirit. But we know that's not the case in reality. I recently had a friend who died from triple negative breast cancer in metastatic. And we know that metastatic breast cancer is the one that kills. We are so scared to talk about it. We're so scared to say stage 4. We like to say aggressive. Even in the news, they don't even like to say stage 4 and things like that. We have to change from that stigma. And the treatments are lifelong, and we need more. The research needs to be focused on more. It's always focused on the early stagers and how to treat them. But what happens is it's a 30% likelihood that this can come back at stage 4 if you were diagnosed early stage. And we need that information to keep us alive. I have been fortunate enough to be on my first line treatment for 5 years, stable. But we know some of us go through medicine like this, a few months, maybe a year here. And we're fighting to keep that. And, we need that knowledge and information, and we need that longevity. If AIDS patients can do it, diabetics patients can do it, we can do it too. We can live long term and be healthy.
When they talk about breast cancer in the news, they say someone died of breast cancer. They don't say it was metastatic breast cancer. Breast cancer doesn't kill people. It's when it becomes metastatic that it kills people. Hope you guys heard that. And I can say this for myself. I am 14 years out of breast cancer, cancer-free. I've never one time been offered a clinical trial. And I had triple negative breast cancer. Never once in all of my years of this work. Black women are least enrolled for many reasons, because of historical mistrust in science and research and so forth. It's just so overwhelming, and you're facing your mortality at 23, 33, 43, whatever it is. I just want to put it out there that it's okay to have these feelings. I cry all the time, but I also live my best freaking life all the time. I'm on TikTok, I'm on Facebook, I'm dancing, I'm living my life, I'm traveling. And one of the things I endeavor to do is make sure that people can feel the emotion around the work, whether it's discussing genetics or disparities or metastatic breast cancer or trials. We're talking about people and their feelings and their souls and their happiness and their fears. And so when you hear the words clinical trials, I'm going to go from one to each of you. What is the one thing you think about when you hear the words clinical trials? I'm going to ask Sonya first.
The Tuskegee experiment.
Aliya, what's the one word you think of when you hear about clinical trials?
Hope.
Shonte, what's the one word you think about when you hear the word clinical trials?
So when I was first diagnosed, I thought experimental. Now I think of revolutionary.
Oh my God, I love that. That's so powerful. Okay, I'm gonna get emotional because this year was one of the most, shocking years of our lives, right? For many reasons. We had COVID happen, and we saw what happened to George Floyd, and the whole world got to see what happened to George Floyd. And the thing about it is that it wasn't the first time, second time, 10th time, and 12th time. The difference with George Floyd, it was caught on camera. I think what's different now is that outcry was so raw and painful and so powerful in what we saw and what we did with that information, that we have had Tuskegee and the history beyond that pain for Black people, Henrietta Lacks. We've had other things happen over the years, but also that we're starting to see that it could be revolutionary. And if we do engage in trials, how that can change outcomes for Black people and transform their lives. And to Aliya's point, have hope. So I'm seeing the full spectrum of all that in this conversation, and that gives me a lot of inspiration about what can happen when we come together as a people, as one people, whatever color we are, allies and people of color, to change the narrative around this discussion and be better advocates for clinical trials. Shonte, I wanted to ask you, many patients that are, when they hear about trials, they think about the fears, like you mentioned, Sonya, around Tuskegee, and the placebo effect and so forth. And people don't often have the things to eliminate barriers to trials, like if they live in a rural community, or if they have hourly wage job, or have kids and no babysitter, or they're single parenting. What are things your healthcare team did to help you have access to trials?
I didn't know then, but I know now that I was actually privileged. And you hear that word privileged, and that's not common with African Americans, that word, right? I was actually privileged to be offered a clinical trial as my first line of treatment. When I was offered it, I had mixed information or mixed feelings about it, because my initial thoughts were, the typical myths and things that you think about experimental treatment, or you usually think clinical trials is offered as the last resort, or you're thinking that I'm not going to get a treatment, so why are you offering it to me? But then as I gained more knowledge about it, and my doctor, who is heavily into research and IRB and NIH and very evidence-based, he explained to me, like, this is an opportunity to, one, get you included in a trial because you're African American, and that's not not offered to a lot of African Americans. We're not in studies. If we were heavily studied, we would probably recognize certain traits and characteristics about treatment, right? And then two, I thought I was going to get the placebo drug, meaning no treatment, but that's a common misconception, meaning, a lot of the trials, especially cancer trials, are not placebo controlled trials. They're treatment based, but you may just get a different treatment than another person and compare the research that way. So, although I didn't qualify for it, I was grateful to have been offered to me and just explained to me in that way, and then realized that it's an honorable thing to be a part of that, because, like I mentioned before, it could be a revolution in medicine. So being a part of clinical trials is very essential.
Aliya, you're a daughter, a mother, a sister, a mother of many, and you mentioned the word hope, which I loved. How has your breast cancer journey empowered you to become a living legacy in your life?
I just started to educate. I started sharing my story. I just use myself as an example because I am the example for my family now. I'm the oldest of my mom's children. She has 3 daughters. And I would say I'm the first in our immediate family. My aunt, who had breast cancer and passed away from breast cancer, was on my father's side. On my mother's side, I do have another aunt who right now has breast cancer. And so I went on Facebook one day and I said, we're not talking about this in our families. And I don't know, I just had a moment. And then my family started inboxing me like, Aliya, we didn't know. Oh my gosh, girl, you just opened up a can of worms. So I'm supposing that the next family reunion, that's going to be the topic of conversation about, getting genetic testing or just having these candid conversations. Going to the doctor, just go for your routine preventative checkup. A lot of us don't even do that. We're not, going yearly for our physicals and stuff and just keeping up with our health. First of all, I was a young mom, so I've always been very upfront with my girls. I don't sugarcoat a lot. I say some things that other moms probably would not say, or they would, wait until they get older. I just tell them straight up, and I'm very honest with them, and I allow them to ask questions. I don't beat around the bush when they ask these questions because it impacts all of us anyway. You know what I'm saying? If they see it going on, is she going to die? I thought to myself, was I going to die? These are real conversations. And then it started, I started having conversations about make sure your house in order. Get your documents together. I started deliberately, and I know it probably make my husband feel a little uncomfortable at times because he would always say, you ain't going nowhere. We don't know that. It does not have to be cancer. It can be a car accident, this is real life. That's just how it is. So a lot of us in our community, we don't take out life insurance. I'm grateful that my mom started that in our family, making sure you have things in order. My 20-year-old went to the gynecologist about a month or so ago, and she shared with the gynecologist that her mom was BRCA2 positive, and the gynecologist immediately said, okay, this is what we're going to have to start getting you prepared for. And I said, how did you feel about her? And she said, I felt very good. I said, let me tell you something. Anytime in your gut you go to a practitioner and you don't feel like they're listening to you, you fire them. That's what you do. You fire them.
That's so powerful, and I applaud you in what you do. It's so important. You don't have to always be like, really intense or really serious. It can be something as simple as going to go play golf, going for a drive, getting some ice cream, and making the conversation really about, you giving your loved one legacy-saving information and life-saving information. Wow, there's so much to talk about here. Just like I don't even know where to start or where to go from. You all are such a wealth of information and so powerful. So I want to go and ask each of you, in terms of fear of recurrence, Sonya, and how do you engage your patients, and how would you encourage them to be more empowered when it comes to their breast cancer experience? And of course, you're going to have fear, but how do you mitigate that as you're navigating the journey?
You try to just let them know that life is going to go on whether you have a recurrence or not, and to live in life in the moment. Yes, there's always that fear. You're going to have that kind of a cloud that's going to be over your head, but worrying about it really and truly isn't going to help a whole lot. And it could actually hurt a little more than it helps if you have that constant fear and that worry that's over your head. So to do your best just to find different practices. I heard Shonte say yoga. I heard other people do meditation. Do what you do to try to just clear your mind of it and engage in life instead of fear.
Yeah, I read someplace that worrying is a fear. It's praying for what you don't want.
I think it's a practice, right? You have to truly engage actively into doing that and engage more into that than you put the energy into the fear. I love that.
Speaking about tools, meditation has been really important to me to help my mindset because, there's a lot of fear in our world. Shonte mentioned losing a friend recently. She's somebody I love. She's metastatic. I now love Aliya. I mean, so that love for that person means that you will be concerned about them. But one thing is to empower them. It's really important to educate them and to help them be their best advocate. But also with meditation, it's about breathing and being in the now. And so whatever you're thinking about in the future, you can't create that. It's going to happen when it's going to happen. What's happening in the moment is that you're educating, empowering, you're loving, you're connecting, you're creating a space to breathe. When we talk about trials in people of color, we hear the words fear and mistrust and all the other things, and having you say the words hope is really touched me and it's very powerful. What do you want our guests to know about what they should think about when they hear the words clinical trials?
I'm not a health professional, so I won't use the terminology that well, but I do understand that if you're not a part of a clinical trial, listen, I did take science in school, and if you're not a part of the control group, if that's what they call it, then how do you know if something's going to work? How do you know if the medicine will work on this particular group with these particular genetics? I made sure to vet an oncologist who participated in clinical trials. That was the biggest thing for me. And how did I learn about that? When I found out about my diagnosis, I joined support groups. In the support groups, people talked about things. And I just took nuggets. I took all the nuggets and I learned clinical trial. I heard that name. And immediately I said, okay, that sounds like something that would be good for me because they can discover a new drug that may help me with triple negative. That's how I processed it at the beginning. And then as I learned more from people like Shonte and Sonya, that it would be in my best interest to not be afraid because, as Shonte said, revolutionary. Yeah. I said yes. For me, putting my business out there on social media was a clinical trial.
There's many things that are in your shelf, in your bathroom, in your kitchen that have had to go through trials. So
everything.
So yes, a lot, everything, and even if it's not through the trial process, there's even products for your skin, hair care. Our lives have been impacted in many ways by things that have been to the trial, and then now are on the market. So I think that there are a lot of things that have happened that have been historically really bad, but I don't want us to use the past as a reason to not change the future and legacy for our generations to come. We have to your point, make health wealth.
Yeah, and you know what I found out when I was trying as discussing clinical trials with African Americans, it takes a little more time because of that legacy of fear, and the fear is real because things happen. But I've always tried to communicate that clinical trials now are being done with the highest of ethical standards. And there really and truly is nothing to fear. I've taken part in a clinical trial before. It wasn't a cancer clinical trial, but it was a clinical trial. My father took part of a clinical trial. And it really does take, in some patients, especially African Americans, it takes just a little more time to really be full and transparent and really break it down before they can be trusting. And so I just encourage healthcare providers just to take a little more time. There's a reason for that fear. Be aware of that and address that and be transparent. Because you're right, we're just completely underrepresented in clinical trials. And as said, there may be something in us genetically that may react a little differently to certain drugs, and we won't know it unless we're represented.
And I want to just say one thing, Maimah. I was offered a clinical trial. My oncologist that I'm with now, she offered as soon as I was done with chemo, and she explained to me. She said, "You're like right at the cusp of not qualifying, but I'm going to submit it anyway because I want to make sure that you're receiving everything out there that's available to you." And that meant the world to me that she still tried. She put it through. It got denied because I didn't meet the qualification.
Even though I'm encouraging people to create a new history, rewrite a new book in this chapter about Black people and clinical trials, we have to acknowledge what happened, and it was traumatic. What you came from, Sonya, is not what Aliya came from or what Shonte came from. There are things that all of us as people of color face systemically when we leave our front doors in the morning and go out in the world. But where you live in your community is different from where I live and what mine is, and our personal family traumas and so forth. So it's important to have a partnership with your provider as a patient and talk about the trauma around clinical trials and build the trust. And we do find ways to find better treatments for Black and brown people. You guys are awesome. Shonte, back to you. With MBC, being a patient who is a metastatic breast cancer patient, thriver, warrior, advocate, what do you want people that are listening and watching to learn about breast cancer?
Don't let that fear drive you so much that you mute yourself, that you block things out, that you don't gain the access and knowledge that you deserve. MBC is just more than just the diagnosis. We have a lifestyle, right? And quality of life is the main component. And with cancer or without cancer, but mainly with metastatic breast cancer, we want to know how we can still live, right? Like my main thing when I first got diagnosed, I was like, can I still work? Yes or no? Oh no, because I'm on crutches. Okay. But what about after that? Can I still drink? Can I still hang out with my friends? Can I still exercise? Can I still have kids? How will this cancer truly impact my life? Can I still have sex? Okay, I'm young, I'm married, I love my husband. How will this impact my sex life? I know now, me being triple positive, I'm in menopause. So that means no more menstrual periods. That means I have hot flashes, I have mood swings, I have low libido, and that totally took away my capability of having children. And what are my adversities I may have? And how can I overcome those adversities? And what goals can I still achieve? I mentioned that I was still in the middle of nurse practitioner school. After like 2 years of stability, I went back and finished it. And I was like, I don't care if I don't even work in it. I'm going to finish my degree and nothing's stopping me. And I always preach, do what you can now until you can't. Because there will be a moment where I can't do what I can now. And so I got approved to snowboard, so I'm back snowboarding, and I'm gonna keep snowboarding until I can't snowboard. Just try to like live your life. Don't plan it out. You can't plan nothing out. What I learned before cancer is that you can't plan your life out. I was a foster child. I didn't expect that. I've been in and out of foster care. I grew up in poverty. Didn't expect that, but I overcame, went to college, got my education. I volunteer and show people who were like me in my circumstance that you can do it, right? That it's more than just what you see and hear. And getting cancer, like you try to plan your life out, but having cancer, I just tell my friends, they be like, oh, I want to get this, but I'm gonna wait. I'm like, what you waiting for? Do it now, because you don't know what your circumstances is going to be next year. So you deal with it the best way you can, and don't let anyone project their feelings on you. How you feel is how you feel. I was told I was in denial because I was in such positive mindset. It was like, well, why aren't you crying more? And why aren't you angry more? Because I can't control it. I'm not going to worry about things I can't control. But if you do worry, it's okay to worry. But don't stay there. Stay in joy more than worry, more than anger, more than pain. And, I have my bad days. I mentioned before I came on. I was in bed all day Sunday in pain, all kind of stuff. But now I'm here. Like, so I take my good with my good, my bad with my bad, but I got a day, right? You live it up. You do as much as you can.
I love you guys. This has been the most amazing conversation. I feel like we're like just like, I want to give you all a big like hug right now. Can we do a big group hug? Group hug, heart to heart. Oh my God, this feels so good. I hope that everybody watching felt the warmth and beauty of this conversation and the empowerment. We discussed the importance of discussing your treatment journey with your provider, creating a plan. We discussed fears around recurrence. We discussed breast cancer and being metastatic. We discussed clinical trials. We talked about life and hope and love and legacy and transformation. And I just am so empowered by you all and inspired by all of you. I hope that you all are as inspired by the conversation as I was. And thanks for being a part of this episode of Breathe TV. I'm Maimah, your host. Until next time, be safe, be blessed, be loved, and we'll talk soon. Brought to you in partnership with Puma Biotechnology.